Hi, my name is Stephanie, and I'm here with Miss Savastina, and we're about to do a clinical swallowing evaluation. So, when you're swallowing, do you have problems with liquids more than thicker foods?
No.
Do you have problems with thicker foods more than liquids?
Yes.
Do you have problems swallowing pills?
Sometimes it depends on the pills.
Do you feel a lump in your throat or pain when you swallow?
No.
Is your voice wet or gurgly after swallowing?
Probably wet.
Yeah, wet, okay. After swallowing, is there increased phlegm or mucus?
A little bit.
Do you find food in your mouth after you swallow?
Yes.
Do you feel indigestion or burning in your chest?
No.
Do you cough or choke while eating or drinking?
Most of the time I'm coughing.
Okay. Do you have a runny nose after eating?
Very rare, but sometimes this happens.
Okay. Do you have an acid or metallic taste in your mouth when you wake up?
No.
Okay. Does it take you a long time to eat?
Yes.
Do you have a dry mouth?
No.
Do you clear your throat after swallowing?
Most of the time.
Okay. When does it occur? When does it occur? During eating or after eating?
After eating.
Okay. And after you finish eating, do you notice the food in your mouth?
Yes.
Does it happen during drinking or after drinking?
After drinking.
Okay. Do the swallowing problems occur during a specific meal, breakfast, lunch, dinner?
Probably breakfast.
Okay. Does it occur certain times of the day, morning, afternoon, evening?
Morning.
Okay. How long have you had this problem? Days, weeks, months, years?
A year.
A year.
About a year.
Okay. Did it occur gradually or suddenly?
Gradually.
Okay. Are some foods easier to swallow?
Yes, absolutely.
What kind of foods?
Like banana or mashed potato.
Okay. Are some foods more difficult to swallow?
Yes, definitely.
Like what?
Like steak.
Steak.
I love steak, but
And are you on a regular diet?
yes.
Okay. Okay, so we have completed the interview portion and we will be moving on to the oral mechanism examination. So I'm going to be wearing my gloves as a sanitary precaution. Okay, so first I'm going to look in your mouth. So, I'm going to look in your mouth and I'm looking for your tongue, soft palate, and anterior lateral foci and tongue. Okay? Close mouth. Just feel your neck. Neck feels normal. And you have all of your teeth. Do you wear dentures?
I don't have dentures, but yes, I have all my teeth.
Okay. Do some things with the jaw. Okay, so can you open and close your mouth? Okay. Move it side to side. Okay. And move it forward and push against my hands. Good. Okay. So push your lips together. Okay. And I'm gonna put a tongue depressor and hold on to it and don't let me take it. Good. Good work. Good lip seal. So put your tongue out and move it up and down. Okay. So use your tongue to push from the front of your teeth to the back of your mouth as if you have peanut butter. One more time. Good. Okay. So now we're going to say a couple of sounds. So I want you to say pop, 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 pop.
Pop, 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 pop.
Ta, 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 ta.
Ta, 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 ta.
Ka, 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 ka.
Ka, 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 ka.
And now put it together. Pataka, pataka, pataka.
Pataka, 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 pataka.
Okay. Now I'm going to check your soft palate function. Say ah, 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 ah.
Ah, 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 ah.
So what I'm looking for is to see if your soft palate is going up and down at the same time. So can you do it one more time?
Ah, 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 ah.
Sorry, I need my flashlight. One more time.
Ah, 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 ah.
Perfect. Now I'm going to check your gag reflex.
Ah.
Good. So I'm gonna touch a side of your mouth, and I just want you to point which side I'm touching.
Left side, right side. Left side, left side.
Good. Now we're going to do some pitch changes. So we're gonna start low pitch to high pitch. Ah.
Ah,
And high to low. Oh.
ah.
Good. So cough as if you have something stuck in your throat. Good, strong cough. Okay, so now we're moving on to the portion where we're going to be trying different foods and liquids. So we're going to start off with the liquids. So we have water, we have nectar, juice, and we have a milkshake. So first we're going to start off with the milkshake. So after each sip, I'm going to tell you to take a small sip and a large sip, however you feel comfortable with that amount. And then at the end, I'm going to ask you to open your mouth and say ah to make sure that everything is clear and nothing is in your vocal folds. As well as I'm going to put 4 fingers to make sure that the anatomy is, that you're swallowing and I can feel it going down. So please take a small sip for me. Say ah.
Ah, ah.
Okay. Can you take a large sip for me? Good. Okay. Can you open your mouth?
Ah.
Perfect. Okay. Next, we're going to move on to nectar juice. So again, take a small sip for me. Good. Ah.
Ah.
Okay. And a large sip.
Ah.
Good. And lastly, we're going to do water. So take a small sip for me.
Ah.
Okay. And a large sip.
Ah.
Can you say ah a little louder?
Ah.
Perfect. Okay. The next is we're going to move on to foods. So we're going to start off with pureed foods, and this is eggplant that was baked in the oven, so it's really soft. So I'm going to let you take a bite, take a small bite, and when you're done swallowing, just say ah. So yeah, take a small piece.
Ah.
Good. Okay. And then just take a regular bite. next we're going to move on to mechanical soft food, and that would be a banana. So take a regular bite as if you would at any other day. Just good. Okay. Okay, and lastly we have regular salad, so we're going to be using a pineapple today. So just take a small piece from the pineapple. Small piece, yeah. Say Okay. And take a little bit of a bigger bite. Did that go down not so?
Yeah.
That was more difficult than
Yeah.
the last? Okay.
Pineapple. Yeah.
Okay. All right, well, we have concluded our clinical swallowing evaluation. Thank you.